TopMedTalk.
Hello and welcome to TopMedTalk. This is Desiree Chappell, your host, and we are covering the COVID-19 crisis from the front lines. We've been talking to people from across the world about their experiences dealing with this disease and this virus and how it's affecting them on a professional and personal level. And our next guest is actually part of the TopMedTalk family, one of our partners in TopMedTalk, Henry Howe, who is technically still a medical student in the United Kingdom at Bristol, but that may be changing. Henry, how are you?
Hi, Desiree. I'm not doing too bad. How are you doing?
Doing okay. We're making it over here in the States. I fortunately am not on the front lines at the moment and dedicating quite a bit of time to TopMedTalk, which is great. But I just kind of wanted to catch up with you and see how this crisis is affecting you.
So I'm a final year medical student at Bristol University, and the COVID crisis has changed things up for us. All of our clinical-based stuff as part of the university is being stopped. So no one's going into hospital placement, everyone's at home. And we're doing sort of Zoom-like meetings with our clinical leads and stuff to find out what's going on. But interestingly for us, our graduation's actually being pushed early. So as of Wednesday next week, I will hopefully be qualified and ready to come and help in hospitals. So they pushed everything forward. Originally, we were supposed to be graduating in July, but we're now being expedited so that we can get out and work from early April.
And is that for all the people that were planning on graduating this year? Because I know that you were going to do an elective and you weren't supposed to graduate until this summer. Are they calling on only medical students that were in their last year? Or are they going back even further with students with less experience?
They're calling on us to start our foundation year program, which is just your junior doctor years here in the UK. So for us, it will be a case of graduating and starting work as a doctor. We're more likely to be helping out in the sense of doing the more ward-based cover rather than going to the front line or facing the COVID patients. But the sort of younger years, they're also being asked to help in a more of a volunteer-based, in different ways, more like HCA sort of roles within the hospital. A lot of the students in the young years are helping out with taking care of healthcare workers' children, for example. So people are helping out as they can in various ways, to be honest.
That's really interesting because I know that was something they did throughout the entire NHS. They've asked retired professionals and those that may have had experience in the healthcare field and even beyond that, but those that may have skills that can help to come out of retirement or to come back into the workforce. Is that something that as a medical student, that a lot of your medical students are choosing to go ahead and volunteer their time?
It's absolutely amazing, and it really is a huge testament to the medical professionals and the students that are volunteering their time and do want to actually go out and help, which is absolutely amazing and fantastic in such a time of crisis. The NHS is a beautiful thing. Everyone absolutely loves it here and everyone just wants to help out. I've actually not really spoken to many people who haven't shown an interest in actually starting work. It is volunteering, like it is up to us. They don't want to put pressure on us to, it is starting work a lot earlier than we anticipated. And starting as a doctor anywhere it's always going to be scary as it is, especially when everything's in such a critical state and everyone's very busy.
Yeah, we call that baptism by fire, Henry. Those of us that have been doing it for a while know how that is. You just kind of get thrown in and you do what you can. Luckily, you've had lots of great training and just getting your feet wet in this particular time will be interesting, but it'll be good. It'll be good for you guys.
I'm very excited. It is going to be a hard time and it's going to be a massive change in what I'm used to as a medical student to actually prescribing and doing the jobs and going on the ward rounds properly. But it is a challenge that I think we've been prepared for throughout the 5-6 years of med school. That could be really helpful, actually.
Mm-hmm. Absolutely. Well, Henry, I know that you're younger than most of us that we talk to on TopMedTalk. I'm not going to call you millennial, but technically you are. Tell me, and I know that, you're in med school, you're driven, have a totally different situation than many people your age have. But, as you talk to your friends and your colleagues, what is sentiment? What are you guys, talking about when it comes to this?
I think people are taking it seriously. You do have the odd person here and there that thinks it's like not really a big deal and it just sort of wash over, which is kind of worrying because it really is the younger generation that has the potential to spread it a lot more than the elderly who are isolating themselves right now. So it is really important, actually, the sort of the message of stay home for everyone. It's not a holiday time. It's not time to go to the park and play football with your friends. It's time to really look after yourself and look after the people around you. And to be honest, most people that I've spoken to have been taking that on board. I think there has been a shift specifically in the UK since the lockdown's been put in place. Yeah. People are taking it a lot more seriously and realizing the impact of the spread of the virus.
Yeah, you have to really hunker down. Do you know what spring break is?
I've heard of it. We don't quite have a spring break here. I wish we did, but
okay. So it's a time in the spring when those who are in high school and college have a week just to kind of let loose. And that's been a major, major issue here in the U.S. Florida has become a hot spot for COVID because a lot of the spring breakers were down there. And as far as, colleges and unis, that you are aware of, did they just kind of lock everything down pretty shortly after this became something?
Well, Bristol University, where I'm at, they were really on it, and they stopped lectures and cancelled uni pretty early on, which is great. The encouragement from the university to stay home has been brilliant. But with the spring break, I've seen sort of articles and stuff, and it is a bit of a shame when you see large gatherings of people, especially younger generations that might not really understand the implications of going on spring break and partying.
Yeah.
It's just a tough thing because obviously, your students, you don't really understand. You want to be having fun, but this isn't a time for fun. This is a time for looking after yourselves and looking after the people around you.
Some people have given the analogy that we're fighting an invisible war. So like in wartime you obviously know there's an enemy and so you can fight, and that's very easy to understand. But especially for young people who are invincible anyway, which I was when I was a kid, you don't think anything can happen to you. And for many, many people under the age of 20, they're asymptomatic. It's hard to understand that. So
absolutely. And as you said, the asymptomatic group is the group that can really cause damage by spreading it without realizing. It's a scary thought, really.
Yeah. Well, Henry, we just wanted to catch up with you and see, how you were doing and to make sure that you're staying safe. And, really, I'm excited for you to, jump into your profession, your career, what your life is going to be for a long time.
I'm very excited. You know what? Listen, it would have been great if I was on my elective in South Africa right now, doing a couple of months in intensive care out there.
Oh,
but
wow.
This is as important, and to be honest, in the times that are ahead, I'm looking forward to the challenge and want to get stuck in.
Yeah, absolutely. Well, Henry, thank you so much. Godspeed. Good luck out there, and I'm sure we'll be touching base with you as all of this continues to unfold over the days and weeks ahead. So keep us in the loop and let us know what's happening.
TopMedTalk.
Thanks for listening. Thanks for reaching out to us. We've had so many people reach out to us through TopMedTalk at contact@topmedtalk.com. Comments on social media. You can always find us on Twitter, LinkedIn, Facebook. We appreciate all those. And we want to continue to provide coverage as long as we can of the COVID-19 crisis from the front lines. Thanks for listening, and we'll see you next time.